Welcome. This video is about how to encourage women to use IUDs and contraceptive implants. I'm Sharon Miyoji Schneer, a nurse practitioner. IUDs and implants are considered top-tier birth control methods, and that they are as effective as female sterilization, yet are easily reversible. Both IUDs and the implant free women from daily attention to contraception and provide women with 3 to 10 years of continuous use. The focus of this video is to help women succeed more effectively and consistently with their choice of methods. For a woman's initial visit, we will use 5 strategies to help her succeed with her method. 1. Help your client clarify her goals. 2. Rephrase her intent. 3. Ask how she intends to accomplish her goal. 4. Determine how important using contraception is to her and how confident she is that she will succeed. And 5. Help your client feel confident with her decision, her self-mastery. Strategy 1. Help your client clarify her goals. First, be sure to avoid asking questions that presume she will have children. You may ask your client, "Do you plan to have a child in the future?" If she plans to have a child, what is her timeline? And ask her when she plans to have her next child. If she's not planning to have children in the near future, she may be more interested in long-acting reversible methods. Rosa, I'd like to talk to you about your plans for contraception. Do you plan to have a child in the future?
Yes, I do. Someday.
Rosa, have you thought about when you'd like to have a child?
Oh, not for a while. I'm still in school and I want to have a job for a few years before I start my family. Maybe in 4 or 5 years?
Strategy 2. Rephrase her intent. It is important that you encourage the client to hear her own statements about her decisions. People embed their decisions better when they have heard their decisions. In their own words. Rephrasing a client's statement also tells her that you have heard her and what she is saying is important to you. It might sound like this. "So, I hear you saying that you do not want to become pregnant in the next 4 to 5 years. Do I have this right?" Strategy 3. Ask how she intends to accomplish her goal. As educators, we have to remember to be client-centered, and that means finding out what she knows about her needs and what her goals are. Only with that information can we shape a contraceptive session that is relevant to her and her life. In this case, you might ask, "So I hear you saying that you do not want to get pregnant for at least 5 years. How do you plan to avoid pregnancy?" Her answer will help you to help her select a method that makes sense to her. You might also ask, "How would you react if you did become pregnant?" This question is important because it allows her to clarify for herself how important or not important a choice of contraception is to her, and to help you, as the clinician, understand her feelings on this matter. So I hear you saying that you do not want to get pregnant within the next 4 to 5 years. So how do you plan to avoid pregnancy?
Well, I use the pill, but I forget it often.
Well, how would you feel if you became pregnant right now? How would you react?
I'd be okay. It's too soon, but if it happens, it happens.
So what if there was a safe and effective way to keep from having a baby for the next 3, 5, or even 12 years? What would you think about that? And what if you didn't need to think about that method every day?
Well, yes, that might be nice.
Strategy 4. Determine how important using contraception is to her and how confident she is that she will succeed. Using importance and confidence scales can be quick and very useful tools to help a woman clarify her choice and build a foundation for success. Find out how important contraception is to her by asking her. On a scale of 0 to 10, 0 meaning that contraception is not important at all, and 10 meaning that contraception is most important, where would she place the importance of using her contraception right now? If she says, for example, that using an implant is an 8, you can ask why it's not less important. Let's say a number 4. Now listen to her. This technique encourages her to tell you why contraception, in this case, the implant, is important to her. Again, she hears her own determination or commitment to use the implant. The next step with the importance scale is to ask her, why isn't the implant a 10 in importance? Again, listen. And then ask, how can you help her increase its importance for her to a higher number? The same strategies used with the importance scale can also be used with a confidence scale to assess how confident she is that she will succeed with this contraceptive method. So on a scale of 0 to 10, 0 meaning that contraception is not important to you at all, and 10 meaning that the contraceptive method is most important to you, where would you place the importance of the implant for you right now?
Well, I'm not ready to have a child. And I want to finish school. I think an 8 for me.
So you're telling me that using the implant is an 8 in importance to you. Why isn't it a 2?
Well, I'm not ready yet.
Ready to do what?
Well, I'm not ready to get pregnant.
Okay.
I want to get my career going, and I want to wait until I'm 24, 25 to have a baby.
Sounds like you've given this a lot of thought and are committed to your goal. And now I'm wondering why the implant isn't a 10 for you in importance right now.
I don't know. Maybe because I do want a family, and a 10 is so final. What if I change my mind?
That's a great question. Even though the implant is good for up to 3 years, you can have it removed anytime you want. It means it's all right to change your mind.
Oh.
So what number of the scale would you rate its importance to you now?
9.5.
That's terrific. The final and most important strategy is strategy 5. Help your client feel confident with her decisions. Self-mastery. Self-mastery is the quintessential foundation for autonomy and success. Confidence that she can achieve and can succeed is the prerequisite for success. All the education and counseling we can provide will fail if our client feels she is not competent to succeed. Part of all counseling and education sessions with women must include strategies that will engender a sense of self-mastery and confidence. This starts with the choice of words we use while talking with clients. Words like try or should undermine success and really support paternalism, or in our case, maternalism. Examples of success-centered comments include, it'll be interesting to see just how much more secure you'll feel knowing how effective your implant is. You can relax knowing that the implant is safe and effective for up to a full 3 years, if you choose to use it that long. Help your clients prepare for success by talking about how they will meet possible challenges with their method. For instance, we know unpredictable periods or spotting can affect your client's daily routine or sex life. You might ask, if you had spotting with the IUD, how do you plan to deal with it? You could also ask, if you needed to use a light day panty liner, what would you think of that? Another question might be, would spotting be a problem for sexual activity with you or your partner? For some women, not having a period is upsetting. You can ask, if you don't have any bleeding at all with the IUD or implant, how would you feel? What would you think about that? If it happened, what do you think your reaction might be? And remember to build her self-mastery and confidence using success language. Just how well do you see yourself dealing with any of these side effects? It's common to have spotting with the implant and never know when your period might start. How might you deal with this if it occurs, and how might it affect your sex life?
I don't think it'll be a problem.
If this does become a problem for you or have any concerns at all, come back and see me. We can talk about it. Occasionally, women will hear misinformation about methods, and it is important to respond directly to her fears in a very clear, decisive manner. It's important to call us if anything worries you about your choice of the IUD or implant. We are experts in family planning and contraceptive care, and we will tell you the correct scientific information. Finally, let clients using long-acting methods know they are special. Not everyone is a good candidate for the implant, but you're a terrific candidate for these reasons. 1, you've really given this some thought and have considered the benefits of this method for you. 2, you've decided to be in control of your future. How does it feel to be in control of your future? So, what have we learned about our success as health educators and clinicians? There are clear strategies that work, and they're easy to use. These strategies produce greater success for our patients, and they feel comfortable to us because they make sense. Let's review them. 1, help your client clarify her goals. 2, rephrase her intent. 3, ask how she intends to accomplish her goal. 4, determine how important using contraception is to her and how confident she is that she will succeed. And 5, help your client feel confident with her decision. As health educators and clinicians, we are the foundation and the experts of reproductive care for women. It is important in our busy clinics that we take the time to appreciate our life and the good work we do. It is a fact that we save lives. It is a fact that our services result in economic and educational success for women. Realizing this impact, our lives go well. Thank you for the opportunity to be with you.